The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay copays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you the access to quality care you really deserve. With no rush office visits, you and I have the time to discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule a history and physical. If you wait, it may be too late. As I announced over the past 3 weeks, I now am accepting no-fault patients. That's right, no-fault patients. So if you are involved in a motor vehicle accident and you want that quality, compassionate care, call my office and schedule an appointment. To my military family, I got your 6. To my Masonic brothers, the light is bright. Today's show, No Fault Part 2. I felt it was necessary to have a continuation of No Fault from Part 1, the previous show last week, to today's show because we covered a lot of material, but I wanted to give a summation and then include more information because it's so important to be educated. The insurance companies, unfortunately, they're not our friends. They're in business to turn a profit and they're not humanitarian, even though they claim to be, but it's their bottom line. So they're not going to put your best interest. I am here, okay? My team, we have an excellent team of lawyers as well as myself and physicians like myself. We are here to represent you. We do not represent the insurance industry. You come first. We put your best interest first, okay? So let's redefine what is no-fault insurance. No-fault insurance is auto insurance that is required by law to cover the costs that occur after a motor vehicle accident occurs, regardless of who is determined to be at fault. No-fault insurance will only cover for economic losses. No-fault does not cover your personal injuries such as pain and suffering. That's something different, okay? So, let's go over something real quick. What to expect when setting up an appointment with Dr. Tommy O. All right, first, you need to call my office and then schedule an appointment. So what I will do is I will refer you to my medical biller and she'll ask you some questions and make sure your claim is in, that you have a claim. We have the claim number, we have the insurance carrier name and the adjuster's name. And then what we'll do is we'll set up an appointment. Once you have an appointment, you will come in to see me. Expect to be with me for 1 hour. This is not a 5-10 minute appointment. It's going to be at least 1 hour. You will then have to fill out a no-fault 2, a no-fault 3, and an assignment of benefits forms. Those forms are very important, and we'll get to that shortly. And then after we fill out those forms, I will do a thorough history and physical, ask you questions, who, what, where, when, why, and how. This information will be sent, will be documented, a very thorough documentation, which is extremely important because that will help you if you happen to have a case and we're going to go into litigation where you're suing. Your lawyers will have to have a very detailed document to help support your case. We need to prove there was injuries that occurred during that or due to that motor vehicle accident. And then we'll set up a plan of action where we're going to set up a protocol. Both you and I will discuss how we're going to manage your care, and we will start the treatments. What to do after you're involved in a motor vehicle accident. I discussed this last time, but I'm going to add a little bit more detail. If you are injured in an accident, the most important thing is getting medical attention as soon as possible. If you are not taken to a hospital, you should still seek medical evaluation by a trained no-fault physician. Why? A day or two later, when the adrenaline rush comes down, after the excitement settles, this is when the signs and symptoms of injury start to appear. So if you blow it off, okay, next, you're starting to feel achy a couple days later. Well, you need to come in. We need to be examined, okay? Take this serious, all right? So I also strongly suggest that you consult with a no-fault lawyer, whether you are at fault or not, okay? You need to know your rights, understand your rights. Your insurance carrier is not going to tell you this, okay? They will not. So you need to consult with a lawyer and discuss the situation. Whether you're going to sue or not, that doesn't matter. You just need to understand what your rights are, okay? Call your no-fault insurance carrier and file a claim. This way, if you need medical treatment, you will be covered by your no-fault insurance. We need to file an NF2 and NF3 and assignment of benefits as soon as possible. Do not wait. No-fault has a strict 30-day policy. If the 30-day deadline expires, it will be an uphill battle to get a no-fault carrier to pay for your medical care that you deserve. As I stated in my opening monologue, if you wait, it may be too late. This is so true, okay? The next, very important, and we're starting to see this happen. It's becoming common. Do not speak to a no-fault adjuster after you put in a claim. Their job is to sign off and close the claim as soon as possible. This is not in your best interest. Once you sign off, the claim is closed. If you sign off and accept payment, the no-fault insurance carrier is no longer responsible to cover your care. Again, if you're called by an adjuster, defer to your lawyer. That is why it's so important that you need to just consult with a lawyer. All right? Because insurance companies, they're going to play games. They're going to want to shut this down as soon as possible because it's their profit margin. They want to shut this down. They do not want to pay a lot of money. All right? So they need to shut it down. My job and your legal representation is to educate you and to help manage your care and your legal services. All right? What is a no-fault trained physician? A physician such as me, Dr. Tommy O, who is properly trained in identifying subtle neurological changes not normally noticed by your PCP or in an urgent care center. A no-fault trained physician understands the importance of properly documenting injuries sustained in motor vehicle accident, as well as treating those injuries with compassion. All right? Very important. We need to go to the right physician, have it documented properly, you're being treated properly, as well as you have the proper legal representation. And if you're having difficulty finding legal representation, give my office a call. All right, I'm working with the best lawyers in our area. These guys are known as bulldogs. They understand the no-fault law. They know your rights. They will educate you what you need to know. All right, we have your best interests. All right, we're going to give you the good quality care you deserve, and you're going to get that legal representation. What are types of accidents? Pedestrian knockdown, all right? I discussed this last show. So pedestrian knockdown, you got the rear end collision, which is the most common. The guy behind you is not giving you enough car length distance. Again, the general rule, the rule of thumb, for every 10 miles an hour, you should be at least a car length distance between you and the car in front of you. If you're doing 50 miles an hour, that's 5 car lengths, and that will give you enough time, what we call reaction time, to figure out what's going on and slam on the brakes to slow down so you're not slammed from behind. The next is T-bone, and then we have side swipe. All right, so we're going down. We got 40 seconds left, so we'll wrap up part 1, and then we'll continue, and we'll start to go into the types of injuries, and that's something I did not cover the first time. So, if you're involved in a motor vehicle accident, I want you to give my office a call as soon as possible. Do not wait. If you wait, it may be too late. Remember, no-fault insurance carriers have a very strict policy, so give me a call. To learn more about my practice, go to drtommyo.com. That's drtommyo.com. Call my office at 631-980-8200, 631-980-8200. Call now. Welcome back to the Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. Today's topic, No Fault, Part 2. As I stated in Part 1 and over the past 3 weeks, I am taking no-fault patients. So if you want that compassionate care, that quality care that you really deserve, someone who's here as a patient advocate, I work hard for you to give you the best treatment. We work together as a team. Both you and I make decisions together. I treat my patients like family. You're looking for that type of care? Call my office. Don't wait. We always say, if you wait, it may be too late. Also, I will be working with some of the top lawyers that specialize in no faults in Suffolk County, and they do cover beyond that, but specifically our community here. So if you're looking for a no-fault lawyer, give my office an all, and I can refer you to a top-notch, some of the best, what we call bulldogs. They will fight for your rights. They will educate you and fight for you. We work as a team. Remember, teams win. Teams win. You and I, we work together for the best care. All right, so let's continue. If you sustained a serious injury, is this covered by no-fault insurance? And I said yes and no. The yes part would be that no-fault will treat the economic losses. However, it will not cover pain and suffering. Pain and suffering will be covered by the serious injury law. That's the name of the law. Serious injury law. To learn more about serious injury law, please consult with an attorney who specializes in no fault. Again, if you need a lawyer, call my office. I will help you. Let's get this going. You want a strong team. Teams win. So let's go on to identifying types of injuries that are sustained by a motor vehicle accident. Now, there's a lot of them, so I'm going to just cover just a few. It's probably the most common, and just go into a little detail. They're going to try to keep it down without using a lot of fancy terminology. So I want to make this as simple as possible, so you have an understanding of what goes on. It's no need to use Latin terminology. So the first would be an acceleration-deceleration injury. Well, it's commonly known as a whiplash. That's right, whiplash. And whiplashes are commonly associated with a rear-end car accidents. All right? A whiplash is a neck injury due to a forceful, rapid back-and-forth movement of the neck. The mechanics of this type of injury is what we call action-reaction. All right, so action and then reaction. There's an action, you have that forward movement, okay? And what happens is the reaction, the muscles tighten up and pull the head back, and that's the reaction. So the muscles in the neck will initially stretch. To counter this, the body immediately tightens those muscles, preventing further damage. As a result of this type of injury, we see decreased range of motion in all planes. Straightening of the cervical spine, that's the bones in the neck. Well, what happens is those spinal nerve, these muscles in the cervical spine in the neck tighten up, and they start to pull on the bones in the neck, and they start to straighten up, okay? So we have your short restrictors and long restrictors, and those are the muscles in the neck, and they help us rotate to the right and left, help us side bend right and left, as well as flex head down or extension head back. Well, they start to tighten up, and it pulls on those bones. And the bones in the neck have a anterior curvature, and that's a natural curvature, and that curvature helps keep our head up, okay? So we are erect. So straightening of the cervical spine, meaning the bones in the neck. Now, when the cervical spine straightens, this may cause myalgia, okay, which is muscle pain. Headaches ranging from mild to severe. Decreased foramen size, okay, foramen, a hole, all right, and the hole is that is formed by the bones in the neck, which allow the nerves to freely pass through without interference. Well, when we have straightening of the cervical spine, the bones in the neck, that foramen, the hole where the nerve passes through, can decrease. And what can happen? We can have nerve impingement. If you have nerve impingement, we can have neurological symptoms such as radiculopathy or a parathesis. Okay, radiculopathy, that's the pain that radiates down into your arms and your legs, and the pins and needles, that sharp pain, or even lack of sensation, that on and off, and that's what you get the parathesis. Cervical spine vertebrae, the bones in the neck, slippage, and that's called spondylolisthesis, okay? And that's a fancy term. All that means is the bone that sits on top of the bone that's below it, it slips either anterior or posterior, and this is graded, okay? You have 1 through 5. The 5, again, as the grade increases, the more serious the condition is. 5 is the worst, which will require surgical intervention, possibly 4, and that's something that your orthopedic surgeon will determine. And at grade 5 is called spondylolisthesis. I mean, that's a tough word, okay? And that's where literally the bone is off the bone below it, all right? Also, disc bulge and herniation can occur, leading to a neuropathy, right? We're impinging the nerve. Head trauma leading to traumatic brain injury or compression of the neck, resulting in spinal cord injury. All right, now, when does this happen? This is a high velocity injury where the head slams into the car, such as the windshield, driver side or passenger side window, depending if you're the driver or the passenger. You can hit the steering wheel, the dash, or the inside of the roof of the car, and you're compressing the spine, and that is serious. A slew of neurological changes can occur, ranging from change in vision, hearing, or dizziness. Here's something that no one talks about. You can get burns on your face, your hands, your chest from the airbag that's being deployed. Okay, so that needs to be documented and treated. Wrist pain or fracture from gripping the steering wheel with a death grip. You know, you're grabbing on height. You're preparing for impact. Well, and sometimes you can even bend the steering wheel. Well, you know, that can cause pain and suffering. You can have bone trauma. You can have fractures. Hitting the dash, the doors, or the center console from being tossed around in the car. That will also cause injuries. That can cause fractures. Needs to be documented. Shoulder injury associated with wearing an over-the-shoulder seatbelt. Injuries can range from myalgia, which is muscle pain, to rotator cuff tendon strain or partial or full tendon tear requiring surgical intervention. Pregnancy. The emotional and physical stress on the body can lead to a spontaneous abortion or after 21 weeks, what's called a miscarriage. This needs to be documented. This is serious. Knee pain. This type of injury is secondary to trauma. Hitting the dash We see less of this type of injury due to passenger side airbags, but prior to that, we used to see the knees slamming the dashboard, and if you really go back far, you had the glove compartment in that area. We also see ankle pain, secondary trauma. Again, you're being tossed around in the car, and you're hitting gas pedal, the brake, the clutch, or the center console. Here's something, I see this all the time, people putting their feet on the dashboard. So you have knee to the face, second to those people who have their feet on the dash. This is a high velocity accident, will push back, and you will have, pain in the face, right? You can have injuries in the face. You can break your nose. You can lose your teeth. You can crack your zygomatic arches, and that's your cheekbone. I mean, there's just so much that can occur when you have your feet up on the dash. I mean, I see this all the time. I'm like, what are these people doing? I mean, you have no protection. You have a high velocity impact that's just going to drive your legs right into your face. All right, so I have, we have so much more, but I just wanted to cover a few of them so you have an idea of what's going on. And I treat most of these conditions, or I will send you out to the appropriate physician that can help you. All right, to learn more about my practice, go to drtomio.com. That's drtomio.com. Or give my office a call at 631-980-8200. 631-980-8200. If you're involved in a motor vehicle accident, give my office a call. Or if you're involved in a motor vehicle accident and you need a lawyer, give my office a call. I will help you get that necessary care and build a team that will advocate for you. Call today.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.